Let's talk about cerebellum function. First, we look at the brain. This is from the side. Here's the nose and the mouth. Here's the base of the brain, spinal cord, and right back here's the cerebellum. The cerebellum gets information from the eyes, gets information from the ears, not only what you hear, but the otoliths, semicircular canals, let you know where you're at in space. You get information from the postural muscles. The cerebellum also gets information from the proprioception from the feet, or whatever's touching the ground. It takes all of that information and then it coordinates movement, coordinates fine motor movement. But if you recognize that fine motor movements, or I should say motor movements, begin up here in the frontal lobe. But not only that, but in the frontal lobe, that's where we get cognition. So the cerebellum has a big play, not only on fine motor movements, but also has a big play on cognition. Bad cognition sometimes is just bad timing that's coming from the cerebellum. Also, to coordinate all of this, the cerebellum has to be able to regulate, or I should say drive, the autonomic nervous system. So it has a big play with the autonomic nervous system. There are physical exam tests that we can run. If I were to take the cerebellum out this way and go A to P, it would look something like this. There are 3 sections of it, and if we were to do a physical exam, we can actually check what's called the middle cerebellum, the intermediate cerebellum, and the lateral cerebellum. What you're getting ready to see in the video is where I checked the intermittent cerebellum before I did an adjustment. I did an adjustment and then I checked it afterwards, and you can plainly see that the upper cervical has a powerful influence on the function of the cerebellum. I'm going to invite you to join along with us on the upper cervical neuro boot camp, where we go through and outline a lot of cool stuff in neurology, and also just go through a lot of things to help you understand how to examine and really assess what's going on from a neurological perspective in the upper cervical spine.
Watch me when you do it. Okay, good. Okay, go ahead.
I still can't do it.
Yeah, you feel that? Okay.
Perfect. Now let your stomach fall, shoulder drop, kind of relax in there. Right. Perfect. Step straight up this way. You adjusted great. Come straight up this way.